Can you explain a bit more about use of testosterone pellets as part of HRT, and which type of HRT will be better, especially if you are diabetic and or hypertensive during menopause? Okay, so let me deal with this second part of the question. Which type of HRT will be better if you are diabetic and or hypertensive during perimenopause? So generally, if someone is hypertensive, we will not recommend the oral estrogen. We will recommend estrogen through the skin, again, because the hypertension will increase your risk of having blood clot. Same for the diabetes. So there's no reason you can't take it, but we definitely need to control your hypertension. And you take estrogen through the skin, and you can have progesterone however you want to take it. Testosterone pellets is not something that at BioConnect, we tend to use the British Menopause Society guidelines. The testosterone pellets are not part of the British Menopause Society guidelines. If you want to do pellets, fine. It's just you need to be very careful that the levels aren't going too high with the pellets, and make sure that whoever's doing it for you is checking the levels regularly. I've seen women with the pellets have 5 times the upper limit of normal. And, there aren't studies to show that if the safety of those very high testosterone levels. And I see lots of people with very enlarged clitorises, they lose their hair, they can have different symptoms. So not everybody will have that, of course, and some people feel a lot better with the testosterone pellets, and that's absolutely fine. But I tend to go based on the guidance, and I follow the guidance. And we use testosterone gel, and we keep the levels within a physiological range according to the current guidelines. The next question is coenzyme Q10 good to take? Yes. You can take coenzyme Q10 is really good if you are having issues with migraine. So it's really good as what we call migraine prophylaxis. So you can take the coenzyme Q10 on a daily basis to prevent you having a migraine, but it's also good for cardiovascular health. Do you need to take coenzyme Q10 is another question. I would say you don't necessarily need to take it. You do the things with your diet and exercise, but if you want to take it, yes, that is a good one to take.